Assalamualaikum students. Our topic of today is pertussis or whooping cough. Whooping cough is an acute infectious disease usually of young children caused by Bordetella pertussis. It is clinically characterized by insidious onset with mild fever and an irritating cough, gradually becoming paroxysmal with a characteristic whoop, which is loud, flowing inspiration. Whooping cough is an acute infectious disease usually of young children caused by Bordetella pertussis. It is clinically characterized by an insidious onset with mild fever and an irritating cough, gradually becoming paroxysmal with the characteristic whoop, which is loud flowing inspiration, often with cyanosis and vomiting. The spectrum of disease varies from severe illness to atypical and mild illness without whoop. The Chinese call it as a 100-day cough. Aging for whooping cough is Bordetella pertussis, and in small percentage of cases, which is less than 5%, Bordetella pertussis is probably responsible. Source of infection is only man. The source may be mild, missed or unrecognized cases. Infective materials include nasopharyngeal and bronchial secretion. Objects specially contaminated by such discharges are also infective. Infective period is a week after exposure to about 3 weeks after the onset of paroxysmal stage. Secondary attack rate is about 90% in unimmunized household contacts. Most fractures include infants and preschool children primarily. Females are more affected than male children. Recovery from whooping cough or adequate immunization is followed by immunity. Second attacks may occur in patients with a declining immunity. It is possible that the first defense against pertussis infection is the antibody that prevents attachment of the bacteria to the cilia of respiratory epithelium. Infants are susceptible to infection from birth because maternal antibody does not appear to give them protection. There is no cross immunity with Bordetella parapertussis. Environmental factors include winter and spring months due to overcrowding. Socioeconomic conditions and ways of life also play a role in epidemiology of the disease. Whooping cough is spread mainly by droplet infection and direct contact. Incubation period of whooping cough is 7 to 14 days. Symptoms of whooping cough include low-grade fever, vomiting, apnea, exhaustion after coughing fits, runny nose, and paroxysm of cough, followed by a high-pitched whoop, which is loud, inspiratory, crowing sound. Bordetella pertussis produces a local infection. It multiplies on the surface epithelium of respiratory tract and causes inflammation and necrosis of mucosa, leading to secondary bacterial invasion. Three stages are described in the clinical course of the disease. Number one is catarrhal stage, which is a typical atypical cough. Bordetella pertussis produces a local infection. It multiplies on the surface epithelium of respiratory tract and causes inflammation and necrosis of the mucosa, leading to secondary bacterial invasion. Three stages are described in the clinical course of the disease. Number one is catarrhal stage, which lasts for about 1 to 2 weeks. Number two is paroxysmal stage, which lasts for about 3 to 6 weeks. And the third stage is convalescent stage, which lasts for about 6 to 8 weeks. Catarrhal stage lasts for about 10 days. It is characterized by its insidious onset, lacrimation, sneezing, coryza, anorexia, and malaise, and a hacking night cough that becomes diurnal. Paroxysmal stage lasts for about 2 to 4 weeks. It is characterized by bursts of rapid consecutive coughs followed by deep, high-pitched inspiration. It is usually followed by vomiting. In young infants, it may cause cyanosis and apnea. In adults and adolescents, persistent cough may be the only manifestation of the disease. The last stage is convalescent stage, which lasts for about 1 to 2 weeks, and the illness generally lasts 6 to 8 weeks. In convalescent stage, episodes of cough become less severe. Okay, now in this figure, you can see subconjunctival hemorrhages, which are the complications of whooping cough. Early diagnosis is possible only by bacteriological examination of nose and throat secretions, which may be obtained by nasopharyngeal swabs. The chances of isolating the organisms are less than 60% if the material is obtained within 10 to 14 days from the onset of illness. The value of fluorescent antibody technique has been emphasized in facilitating the rapid diagnosis of pertussis. Other investigations include X-ray chest, ELISA, etc. Complications occur in 5 to 6% of cases, most frequently in infants less than 6 months of age. Complications include bronchitis, bronchopneumonia, and bronchiectasis. There may be subconjunctival hemorrhages, epistaxis, hemoptysis, punctate cerebral hemorrhages, convulsions, and coma. Bronchopneumonia occurs in about 5.2% of cases. It is the most prominent problem with relatively high mortality. The incidence of pertussis associated encephalopathy is 0.9% in 1 lakh individuals. Control of whooping cough and cases can be made by early diagnosis, isolation and treatment of cases, and disinfection of discharges from nose and throat. Erythromycin is the drug of choice for whooping cough, and its dose is 30 to 50 milligrams per kg of body weight and 4 divided doses for 10 days. Possible alternatives are ampicillin, ceftriaxone, or tetracycline. In contact, infants and young children should be kept away from cases, and prophylactic antibiotics such as erythromycin or ampicillin treatment for 10 days to prevent the infecting bacteria to become established. The best protection can be given to an infant is to administer a booster dose of DPT or DT to his siblings before he is born. Active immunization is the best preventive measure for control of whooping cough. The vaccine is usually administered in the National Immunization Program of Pakistan as combined DPT or pentavalent vaccine. There are usually 3 doses which are given at 6, 10 and 14 weeks, and then booster is given at 16 to 18 months and then 5 years of age. The dose of vaccine is 0.5 ml intramuscularly. Adverse effects of whooping cough vaccine include persistent screaming for more than 3 hours, collapse, local reactions at the site of injection, mild fever, irritability, seizures, hypotonic, hyporesponsive episodes, anaphylactic reactions, encephalopathy, epilepsy, convulsions, CNS disorders, febrile episodes, etc. Health education should be given to minimize exposure from susceptible persons. isolation and restriction of cases, regular health checkups, educate pregnant women to keep distance to such cases, and active immunization.